Perfect. And Verily, I'm going to share the PowerPoint, and then you'll be able to take us away.
Thank you.
Give me 1 second. I'll start it up. All right, Verily, it's all yours.
Super. Thank you so much, Jose, and for all your help with the panelists, etc. So good morning, everybody. Welcome, panelists. Thank you so much for being with us this morning. And welcome to all the other attendees. We're delighted to have you here. So next slide, please. So meet our board. I'm Verily Keenan. I am the president. I'm newly elected president of Nepta. I'm sure many of you know our amazing former president, Ryan England. Ryan has stepped down due to his many other commitments, and we wish him all the very best. So I've been a member of Nepta since 2014. I was elected to the board in 2016 and to vice president in 2018. I'm honored to serve as our new president. So my career has spanned business, economic, and workforce development, and I now work as a business services representative with Arizona at Work, Maricopa County. Next slide, please. So here's Jose. He is newly elected as well. He is our vice president, and he is still serving as our treasurer. So a bit about Jose. For the past 30 years, he served in various capacities in social services, ranging from working with young adults for social change, adults living with HIV and other chronic health conditions, adults covered by Arizona Health System in Maricopa County via crisis services, workforce development, employment, and psychosocial rehabilitation services. Jose's current position is a senior project manager with employment and rehabilitation for Aetna. Jose is a proponent of employment and psychosocial rehabilitation services and recognizes their impact on members finding their passion. He intends to continue working within public health sectors, guided by a purpose to ensure quality services, staff development, and transformative change. So a bit about Jose, very accomplished vice president and treasurer. So here we have Maggie Kasparek, our secretary. Maggie is an experienced economic development manager with a demonstrated history of working in the health and wellness industry. Employment history includes AT&T, United States Chamber of Commerce, Simpatico, and Mercy Care. Maggie has skills in management, business development, sales, training, and human resources, as well as economic development. And Maggie has been a member of our Nepta board for over 10 years. That is Maggie. So I'm very excited to announce that we have two new board members. Firstly, Sherry Cesarinski, and Sherry's going to say a few words. So over to you, Sherry.
Sure. Thank you, Verily, Ms. President. Very happy to be part of the board. I recently moved here from Omaha, Nebraska. It's been 3 years now. Time really flies. And I've worked in workforce development, working with TANF programs, as well as WIOA programs on the business services side. And so when I was planning to move out here, I was looking at different groups that are involved in workforce development and helping people, return back to work. And I saw NETPA and I thought, gosh, this is just a dream because, where I came from, when you tell people that you're in the business of helping people find work, they're like, oh, you're a recruiter. Like, well, no, that's not exactly what it is. They don't really understand, but it was a whole group of my people. And so I was just ecstatic to get an introduction. And that's how I met, heard of Maggie and Verily, as well as a couple other folks that are no longer part of the board, but was very excited when I was asked to become a member of the board. And I'm here also proudly representing the Arizona Apprenticeship Office as part of the state of Arizona Department of Economic Security. So thank you for having me.
Thank you, Sherry. And again, welcome. So now our other new board member we're excited to announce is Winslow Zhang. So Winslow, would you like to say a few words about yourself, please?
Absolutely. So my name is Winslow. I've been working for the Valley Life for about 5 years now. I moved to Phoenix about 5 years ago. I've been a job developer, basically connecting employers with unemployed populations. And I recently got my MBA degree from GCU for the strategic human resource management. I'm also a certified SHRM CP and a member of SHRM Great Phoenix chapter. It's my honor to connecting employers with all my clients and other unemployment populations and getting them back to workforce. Thank you.
Thank you, Winslow. Appreciate that very much. And again, welcome, Sherry and Winslow. So now I'm going to talk a bit about our Nepta core values. Connecting the underserved to the right employers. We feel some job seekers are underserved, for example, those with limited English, criminal background maybe, or disabilities. So we are very keen to help them. We certainly believe in and want to grow our community of obviously employers and job seekers. We believe passionately in that. We do what's unconventional. We like to examine the way we do things. Just because it's always been done like that doesn't mean it can't be improved. So Nepta's purpose, together with our community partners, we recognize job seekers with barriers and challenges, and we strive to connect them to long-term gainful employment. And finally, our vision. In 3 years, we are hoping 50 companies at least belong to the Nepta organization. They will receive guidance, support, and direction as we help them hire qualified individuals facing barriers to employment. Next slide, please.
No, I seem to be having a technical challenge. There
Oh,
we
there-
go.
Well, it wouldn't be a Zoom meeting without a technical problem, would it?
Absolutely.
So good. So that's ours out the way. Okay. So this segues into encouraging anyone on the call who hasn't already done so to join Nepta. We'd love to have you as a member. If you're a member, then of course you can be considered for a board membership, as Sherry and Winslow have. So again, we encourage you to join Nepta. We feel the yearly fees are very reasonable, only $25 a year for an individual, and $75 a year for a company organization of up to 5 employees. So as you can see, there's a link there to our website where you can join, and any of our board members will be very happy to give you any more information about joining. And again, we do encourage you to join Nepta. Thank you. Okay, so here's the exciting bit. We are delighted to welcome these great employers today. Again, thank you for coming. And Jose, I'm going to hand it over to you, please. Thank you.
All right. Thank you, Verily. I'm going to stop sharing my screen right now so we can get everyone's wonderful smiling face on the recording. So welcome, our great employers. And what I'm going to do is I'm just going to ask some very informal questions to each organization and give you a chance to respond to the question and answer any questions from our attendees. So let's get started, and I'm just gonna follow my screen, and we're gonna get started with final mile delivery. Welcome, Mike Dodd. Why don't you tell us a little bit about your organization and what types of positions you're seeking?
Well, good morning. My name is Michael Dodd. I work for Final Mile Delivery. We have a contract with Amazon to deliver packages for Amazon. So the big blue vans that you see driving around that say Amazon Prime on them, those are companies like myself. We have several competitors to me, but who look for drivers on a daily basis. I'm looking for a driver that has a good background, has a good driving record, and is fit to be able to carry packages at least 50 pounds.
All right. And okay, thank you so much, Mike, and we'll get back to you with some more questions. So
Okay.
Next up, we have CBI, and from CBI, we have Garrett, Julie, Lauren, and Corrine on the line. And so I'm gonna ask you, just tell us a little bit about your organization and the type of positions you're looking to fill.
Yeah, thank you for having us. Community Bridges is a behavioral health company that provides integrated care for individuals that are in need. We have a lot of different positions open. and are eager to have persons that are interested in the healthcare industry, healthcare field, which is always a high need in society. And so it offers more than a job, but a career path. So we have positions available from an entry level stage all the way up through to counselors, nurses, nurse practitioners. We have individuals that go out into the community that carry job titles like navigators, navigator 2, rehabilitation specialists. These are persons that go out into the community and help patients or persons of need to get back on their feet. We tend to meet them at usually their worst day, and we want to help turn that around and get them to their best day, their best self. So a lot of opportunities at Community Bridges, a lot of great benefits that include a very robust PTO plan, very inexpensive Blue Cross Blue Shield type health benefits, and then just a great opportunity to really get your foot in the door and join a company with a powerful mission of maintaining the human dignity, or the life of the dignity of human life. There we go.
Well, thank you so much, Garrett. Does anyone else from CBI want to chime in before I move to the next organization?
Yes, this is Julie, and I just really want to highlight that one of our core values within CBI is our peer support career path. So we do hire individuals with backgrounds, the criminal justice backgrounds, so on and so forth, and really believe in, giving folks second chances. We have peers that are infused throughout all levels of our agency, from entry level, as Garrett said, all the way up to our executive team. So the peer model is something, in conjunction with our clinical disciplines and our medical disciplines, we really, really believe in working with our peers, developing them, and helping them to promote into additional positions. We also have locations throughout the state of Arizona. So not just in Maricopa County, we have locations in Tucson, up in Winslow, Payson, Yuma, Cochise County, so on and so forth. And we can later on share a PowerPoint that you can maybe send out to everybody with all of our information on it.
That would be great. And also, I want to just let the panelists know, you can please go ahead and enter your contact information in the chat so that folks that are attending can get your contact information. And just remember, when you're going into the chat, that you make sure it's going to everyone, not your fellow panelists, because that happens quite a bit. So if you're going to put your contact information in the chat or your website where that has your job listings, please feel free to do so folks can click on that. Thank you so much, CBI. And now we're going to go to Jennifer Nye from Terros Health. Why don't you tell us a little bit about your organization and the types of positions you're looking to fill?
Sure. Hi, everyone. So Jennifer Nye with Terros Health. So we are an integrated healthcare company. We offer primary care services, and we specialize in substance use and mental health treatment. Our compelling purpose is to inspire change for life. Our core values are integrity, compassion, and empowerment, with diversity woven throughout all of the services that we provide. We want to create healthy communities. We look to provide care to patients wherever they're at on their journey for recovery. And we are also statewide, similar to CBI. So we have clinics in Maricopa County. We have 4 federally qualified health centers in Maricopa County. We have 3 clinics that specialize in treating adults with serious mental illness. And then we also have a residential facility in Maricopa County that serves adults with co-occurring disorders for substance use. And then we also have mobile crisis teams. So we have mobile crisis in Maricopa County and also in Northern Arizona in Mojave, in West Yavapai, and then also in Coconino County and Flagstaff. And then we do have a program that is dedicated to a contract with the Department of Child Safety that serves adults that are experiencing a child welfare situation, and they've been referred to us for substance use treatment. And we have that in all of the counties in the Northern Arizona area, in Maricopa, and then also down south. We have a clinic in Tucson. We are looking for positions across the entire state. We have several positions that work with our adults with serious mental illness. That includes peer support positions, as Julie kind of mentioned, case managers, rehabilitation specialists. We are looking for master's level and licensed clinicians to work with people with mental health situations and also substance use disorder treatment. Those are throughout Maricopa County, and then also a couple in Northern Arizona and in Tucson. And our mobile crisis teams are definitely hiring. So we have several crisis specialist positions that are open also across Arizona. And I will turn it over to Heather for anything that I might have missed. Thank you for having us. We appreciate it.
Thank you. Welcome, Heather. Do you have anything else you want to chime in with regarding Terros?
Well, thank you. Jenny covered a lot of it. Mainly that's the gist of it. We do have a lot of different positions available all throughout the state of Arizona, most of which would be direct care positions like case managers, individuals that we're looking for caring professionals that want to help individuals that may be court ordered to receive treatment. They maybe have a serious mental illness. We do like to hire recovery coaches or peer support specialists as well, because we really believe in giving people a second chance. We are a somewhat background friendly employer. We do take them on a case-by-case basis. I will say that every employee must be able to obtain a level 1 fingerprint clearance card, which of course is based on a background. But if somebody has something in their background, you know, that lived life experience is sometimes what can make them really good at turning around and giving back to those that may be in a somewhat similar situation. So we definitely want to encourage them to apply and talk to them about what might be a good fit. We do have great benefits available for all full-time employees, effective the first of the month following their date of hire. We have a great wellness program, a lot of good incentives for employees, including a unique partnership with GCU that offers discounted tuition for those that are looking to continue their education as well. So yeah, I think that's kind of the gist of what we have available, but of course I'll put my contact information in the chat as well. I am a senior recruiter with Terros Health, and I'd be happy to speak with anybody that has more questions about what's available. Thank you for having us.
Well, thank you so much. I appreciate that. All right, next up, we have Janet from Peckham. And Janet, why don't you tell us a little bit about Peckham and what you're looking for?
Sure. Good morning, everybody. Thank you for inviting me. I'm glad to be here. Peckham is a nonprofit voc rehab organization. The company itself is a little over 44 years old. Our headquarters are in Lansing, Michigan, but we've been in Phoenix for 8 years this next month. We are hiring on a government contract through the, for an inbound call center. It is a customer service rep, and the organization that we have the contract with is the U.S. State Department. So you do have to be able to pass a background check and eventually get your security clearance. So it's an inbound call center where you're receiving calls. You're not selling anything, but you're talking with individuals that are looking for assistance and information on how to obtain their passport or anything to do with their passport, whether they maybe have one that was lost or stolen. Or we also take congressional calls. We take duty officer calls. We have help desk positions, not IT, but it's more like a supervisor help desk positions. A lot of upward mobility. We're located in the northwest part of Phoenix, off of the Black Canyon Highway and Thunderbird Road. So if you're familiar with that area, there's a lot of construction going on right now, so we're a little tricky to find. But it isn't. We've been named 2021 Great Place to Work. And if you know about that, that's, yes. Yeah, I see you clapping. Yes, Terros Health, you have sent a lot of people to us, so thank you. And CBI, I think you were here and I missed you. Somebody was here from CBI and I missed you guys. I was in a meeting and I'd love to do a tour. We are open now to do tours. However, when you do come and visit, I'm in the office today and when my door is open, we are masked up. So we're still mandated to wear a mask. What more would you like to know? I'm sure you're going to ask us questions a little bit.
Yeah, there are more questions to come, so no worries about
that. Contact information and a flyer in the chat.
Awesome. Thank you so much, Janet. All right, next up, we have Elizabeth representing Blue Cross Blue Shield of Arizona. Welcome, Elizabeth. Why don't
Yeah,
you tell
thank
us
you.
a little bit about your organization and what you're looking for today?
Sure. Thanks for the plug earlier, Garrett. You mentioned Blue Cross Blue Shield coverage as part of your presentation, but Blue Cross has been around for over 80 years providing healthcare insurance coverage for Arizonans. The mission is to make Arizona healthier, and we're really looking for individuals to help support that mission. And you know, even if we don't have a role that's open today, you can view all our postings at jobs.azblue.com, and we're hiring like most here today for different levels across the organization. We have finance, we have marketing, we do have clinical positions as well. Our entry level is considered customer service. We don't have an opening posted right now, but we are gearing up for an opening next month. So I would keep an eye out for that if that's something you might be interested in. It is a call center environment. And then if you go to our site and you don't see anything that, you know, catches your attention today, I would encourage you to sign up for alerts. There's an option to do that, and you'll be notified as soon as any new opening becomes available. There's also a chatbot on our website. You can engage with that chatbot and request to speak to a recruiter, and you'd be connected to somebody on my team to talk about the organization in more detail, our culture, you know, our community involvement. Like Peckham, we've been voted and awarded some great awards, and I just think that speaks to the organization and the culture that we have. I'm happy to dive more into detail, but really just looking for the right fit versus a particular position or skill level. I think we have a wide range of openings that would be interesting to most people on our website today.
All right. Well, thank you so much, Elizabeth. We appreciate that.
Yep, thank you.
Next question I want to ask the panelists are, let's talk about your company culture. Let's talk about why someone would want to work for your organization. Give us some insight into what the field is like, what the culture is like, how you grow your employees. And we'll get started with you, Mike. Tell us about final mile delivery and why someone would want to work there.
People want to work for us because we're a big team atmosphere. We run about 23 to 30 routes per day. We're 7 days a week. And we support each other. I have dispatchers and operations managers that are constantly on chats and on phones with drivers, and it's more of a, you know, a big happy family. That's why people stay, why people want to work for us. Amazon is a big account. So people they say things like, we like delivering smiles, just like Amazon. So they love doing that. It is hard work though, but by the end of the day, they work 10-hour days. They get off about 8:30, 9 o'clock at night, and they're exhausted. Our operations managers and dispatchers are making sure that they're checking on their health as well. Making sure that they're hydrated, water, giving them all sorts of data on what water does for them and what Propel or Gatorade or how it can help and how it can hurt you. So yeah, I mean, we just a big happy family that likes, you know, they have something accomplished by the end of the day.
Awesome. Thank you so much. So Mike, you mentioned the folks are working 10-hour shifts. It's really hard work.
Yes,
Describe
sir.
to me what type of individual would be successful with you.
The people that are very successful with me are people who show up, number one, because obviously we're a attendance-driven company. Those routes need to be delivered. They show up. I've had 70-year-old men who work for me and 21-year-old with athletic or not even athletic, just looking for a good day's pay for a hard day's work. So they are troubleshooters. They know how to, once they get into the field, they have a problem with the package. They know the tips and tricks on how to fix that to make sure that package gets delivered.
All right. Well, thank you so much, Mike, for that insight. All right, CBI, I'll open it up to you. And I know we have a couple of staff members on, and maybe they could speak directly to the culture of CBI. And just from to offer a little additional insight, I work with CBI on a pretty regular basis as an employment rehab manager. And it is definitely an organization that is based on people with a shared experience giving back to helping others. So I want to put that out there, but I want to give you an opportunity to talk about your culture, what you're looking for, and what would make someone really successful in working with CBI.
Hi, thank you, Jose, for that intro. I'm Corrine. I work with Community Bridges. I've been here about 6 years. Culture is a really important part of an employment agency. When we are interviewing candidates, we make sure that it's a beautiful, like, mutual benefit. We want staff to feel like they're part of something bigger, that they feel valued, that they feel seen, that they understand that we're here for the members, right? If it's not for the members, we ourselves wouldn't have a job. And many of us started as those members. We've been through some of the things that our clients or our members are going through. And so a big part of our culture is that we're flexible, that we're a team. Yes, we may be in the community doing something autonomously by ourselves, but we're always connected to a greater, bigger team. We're very interdisciplinary. We work across these really beautiful teams. We have people with various lived experiences, educational experiences. And so I've loved since day one with my foot in the door at Community Bridges is that sense of community. I mean, our name is Community Bridges, and that really says it. Not only are we within each other, but we're constantly trying to, like, I love this network that we're doing today. Like, we constantly are trying to feel like, how can we make everyone feel connected to something greater than themselves? Like, nobody's alone. Our clients shouldn't feel alone. Our staff shouldn't feel alone. There's so much to do to help everyone feel empowered, connected, understood, and excited about life, excited about work. And that's, I mean, our jobs, we look for people that are creative, that are open-minded, that have passion, and of course, that have boundaries, right? We have to be able to take care of ourselves as well as take care of the people that we're working with. And we work with a lot of people that are in hardship, that have little to nothing. And we have to be able to recognize our job is to connect them to the right resources, to the right people, to educate them on what they can do and what they're able to do and what's around them, and not to give or to sacrifice from ourselves, right? But just to help them recognize, like, we've been possibly in similar circumstances, and there's ways to get through it. Let me talk to you about things that we can do, and get them excited and understanding that there is something greater. And I've always enjoyed partnering with you, Jose, because I think understanding, like, employment is huge, right? And so we talk a lot to our members about employment, like having that sense of purpose, that belonging. Once you're connected to an employer, you start to recognize, like, people value me, people need me, and that's an exciting feeling. So your role with us has always taught me a lot. And I'm excited to get to do that same thing for staff and for clients. It's just, there's all these parallel experiences. It's a very rewarding, like Mike talked a lot about demand. The demand is there. Oh, definitely. People need things, people want things, and we get to be part of that bridge to help them be connected to those things. We can never be 100% of the solution. So it's again about understanding, like, oh, look at Mike can help you. And oh, look at maybe Terros can help us with this. And Jose is really good at this. So not only do our clients need to learn how to leverage the different staff on our team, but we as CBI need to learn how to leverage different programs within Community Bridges and all across Maricopa County and other counties. I think it's just constantly learning more and understanding how to connect. Like, not everyone's going to have the answer. So where do we go to learn more? And that's a really beautiful opportunity that Community Bridges is really trying to seep and expand for everyone that we're connected to.
Thank you so much, Corrine. CBI, do you have anything else you want to add?
Hi there, this is Lauren.
Hey, Lauren.
I'm a clinical lead with CBI. I've been with CBI for 7 years now, and I do want to share in the same sentiments that Corrine and Garrett shared, but I want to also emphasize that, I am, as a representative of CBI, I think I am someone who has lived that experience that Garrett described, starting at an entry level. I came from an out-of-state location, and CBI opened doors for me. So I think that, one of the things that I'm proudest of when I think of CBI is we are an agency that will open doors for individuals in the community, for professionals in developing their career, whereas doors were once closed, they are now open. And we are incredibly dedicated group of individuals that we are the agency that sticks by you, and we are going to help you no matter what. So it doesn't matter how many times you need to go through a process or experience something, we are going to be there, and we are not going to say no to that individual in need. And that is something that I am proudest of, that we are constantly thinking of unique and dynamic ways to figure out and problem solve and create opportunities for people. So not only on the professional side of things, I think that that's huge, that we can create those opportunities for professionals. We also do that for the people that we help. So I've noticed a huge experience in my career with CBI being teamwork. Obviously, we keep talking about teamwork with a lot of these different agencies here today. It really has been my experience. I think part of my success at CBI has been building teamwork and creating really successful outcomes for individuals. The populations that we serve and work with often experience incredible hardship, where there's a lot of defeat that happens in their lives. And I have personally witnessed amazing things happen for these individuals with the help of CBI and the ever-growing programs that we have. It seems to be developing bigger and bigger every day. So it's a great place to be.
Thank you so much, Lauren.
Yes, thank you.
All right. So next up, we're going to offer the same from Terros. Just tell us a little bit about your culture. Why would someone want to work for you? But before we even go there, Jennifer, I just want to say, when I moved from New York City to Arizona, I would say 16 years ago, the first job I landed was as a Terros mobile crisis counselor. And I did that for almost 2 years. And I have to say it was so rewarding. It was a great opportunity to learn the behavioral health system. It was a great opportunity to work with members in need and help them get those needs met. And I'm very fortunate to sit on this panel because I have the opportunity to work with Terros. I have the opportunity to work with CBI. I have the opportunity to work with Nepta. So I really know a lot about these organizational cultures. And so I'm super excited that you guys are here to talk about it. And with that, I'll open it up to you, Jennifer.
Thank you, Jose. That's awesome to hear. Yes, our mobile teams are the crux of the community and serving those folks that are out there who have an acute need. So beautifully said, CBI. Thank you for sharing all the wonderful things that teams like yours and ours do. So the culture at Terros that I'll say is that, we're a company that wants to exude compassion for everything that we do, and we put our employees first. I think that's the number one thing that I would like to share with this group, is that if we can't take care of our employees to make sure that they're whole and safe and feeling good with what they're doing, then the patients that they serve aren't going to feel that. And so we work really hard to try to make sure that all of the employees that are a part of our company feel heard, have support, have opportunity for mentorship, for development, for whatever it is that they're looking for to do in their career path. We've worked really hard to try to get career pathing for our staff that might not usually have a career path. So someone who's in there as that front person at the front office who that's what they're doing and they've been there for 5 years. But what can we do to get them some extra experience so that they can move on into something bigger and better? And making sure that our employees know that literally, regardless of the role that they're in, they are saving lives. They don't have to be that crisis specialist that's out there dealing with someone who might be feeling suicidal in the moment. They're saving a life, but so is the person in our finance team who's running those numbers in the background to make sure that we can keep our doors open. That's the person that's also saving lives. And so we really want to make sure that everyone knows that the contribution that they are providing to the organization is really what's out there providing the support so that we can be out there in the community, and that so those case managers and peer supports and clinicians, the doctors, they can all do the work that they need to do. We do look at leadership development opportunities. We spend a lot of time making sure that our leaders are equipped to be great leaders and getting the staff what they need in order to do their jobs really well. We meet every single month with 100% of our folks who are in supervisory and management roles. And we spend 2 to 4 hours with them every single month to make sure that they have the knowledge that they need, that they're getting tips on how to supervise more effectively, mentorship and coaching opportunities, all of those things to develop their leadership skills. And that's been really well received over the last few years. And then fun, I'll just say that, like we encourage our team members to have fun with each other. We do spirit weeks. Each director at the sites has their own little ways to keep the fun going at their sites, whether that's, bringing in little food snacks or dancing in the hallways or, whatever it is. They all do their own unique thing. And we just encourage and love to hear that those things are happening. So I love Terros. I have been with Terros since 2008. We were originally Choices and then acquired by Terros, but they were our operational organization. And so 13 years with the same company really says something about the culture and what it is that they do to keep really great folks around. So thank you.
Thank you. Heather, do you have anything you want to add regarding Terros?
I think Jenny and I both thought of all the same things because that was going to be my list, is career growth options and fun. Our Spirit Week, our wellness program is another one that I want to point out because we have great benefits available for employees, and part of that is a wellness program. So we have fun little activities because we work really hard working in direct care with really challenging populations. I mean, it's really taxing work and it takes a toll on us as employees as well. So we really try to incorporate also enjoying where you work. Like Jenny mentioned, we have Spirit Weeks where you can dress up, there's theme days. We have pumpkin carving contests at our clinics and things where they get to just really show their personal side and make it more interesting for the clinics. But we also have wellness programs where we have virtual walks across the Grand Canyon, taking care of yourself, getting your steps in, trying to exercise on your downtime. And then we have bingo challenges and there's prizes and there's a lot of things like that that also make it just a more fun environment. And then I can say as a recruiter with Terros, one of my favorite things is helping people to grow their career. I love when I get to extend an offer to somebody who's been with Terros. Maybe they started out as entry-level position or they started out as a peer support and they work their way up and they gain more experience and they get training and more skills and you get to promote them. And just that excitement and people just loving being at Terros and wanting to stay with us is really rewarding. And that's one of my favorite aspects of it. We also do offer internships and supervision. So we're looking to hire clinicians. We have a lot of clinical professionals, individuals that may be licensed with the state of Arizona. Maybe they have their associate's level license and they want to pursue their independent license. We will find somebody to help provide that supervision for them because that's really important with us as well. Again, trying to promote that growth and help them to grow their career and stay with Terros. And yeah, it's just a few things that I think are really what make us really unique.
All right, well, thank you so much for that. All right, Peckham, tell us about your company culture and what it's like to be a part of that organization.
Sure. First, can I just say, Elizabeth from Blue Cross Blue Shield, I'm intrigued in your background. Is that a real case of little miniatures of something? They look intriguing.
Yeah, they're transformers.
Nice.
That's not from here. I was like, I want to zoom in. Okay, cool. That's very fun. Culture at Peckham is, well, bottom line, it's kind of busy and casual. So business casual, but it's busy because it's the National Passport Information Center. And as you know, 2020 really threw us for a loop worldwide. And so coming back through that 2021, it's still busy, but not as bad as it was. So what we do to help our call center team members is to we do mindfulness classes, different kinds of classes. And if you'll excuse me, I want to show you something. I'm going to bring it over here and show you some of the things we do, okay?
Okay. Oh, we're getting a live demo, people.
Well, this is what I created. We do painting on canvas, so it's not perfect, but we're not perfect. It was fun, and it was an hour and a half off of the phone. And I love to do stuff like that. We also create Zen gardens. Next week, we're doing a tie-dye class. We have a small gym where our team members can go in before or after work and work out if they want. We're also wellness aware. We all offer everyday fresh fruit and vegetables for our team members as well as our staff. We're having a flu shot clinic next month. We did the COVID vaccine clinic this last spring. Just all kinds of fun stuff. We have competition with our teams. I know you guys, someone said that from Terros, I think, was it maybe, or CBI? Someone said that. So a lot of fun. Passport Pete is our person who is like our, shoot, can't think of the name, can't think of the word, but he's a little Passport Pete guy, and he goes around with
Your mascot?
Thank you,
Oh,
mascot.
wow. Oh,
That was
wow.
the word. It was kind of rolling around in there. So we just, again, we try to keep it fun. We had a food truck here on a Friday. So that was kind of nice to have tacos free. We love to feed our people. I don't know, call centers, they like to feed people. I don't know what it is. We're sitting all day. We really shouldn't be feeding them. But we just in general like to try and get the people off the phone and do something for themselves. We have human services, vocational service specialists that are employees as staff here, and they work with each one of the team members. They have a caseload to help them with accommodations they may need, or to maybe even direct them towards any kind of budgeting or housing or anything like that, to help them to be an effective individual and successful with their job. Because as we know, there's always a lot of baggage that we bring into things. Some of us, it's enough baggage that fits into a coin purse, and sometimes it's enough baggage that fits into luggage that has to go, you know, it doesn't fit on the plane. I've been here 4.5 years, and I kind of stumbled into this job from a career advisor position that I had with another organization, and that still stays with me. But I say that because I love it, because I can welcome people to Peckham. Sometimes it's their first job, and sometimes it's their first job in a really long time. So we just welcome all of you community partners that send people our way. And that's all I can say.
All right. Well, thank you so much. Now we're going to go back to Elizabeth to give us some insight into Blue Cross Blue Shield of Arizona. But before we do that, Elizabeth, I have to know, is that your collection?
It isn't. My husband's a big collector, obviously, and on the side that you can't see is a full wall full of 80s boxed figures that he grew up playing with. So it's definitely a fun room to be in. I'm lucky he gave me a little piece of that to work out of when we went remote. I'm sure as the weather starts to cool down, he's gonna start pushing me to the garage or something so he can have his space back.
All right.
But they're
Thank
good
you.
recruiting tools too. Well, thank you. I would say, Blue Cross Blue Shield, we did a recent employee engagement survey. We're doing that pretty frequently now because we are working remotely. About 97% of us are still working remotely. And we're going to continue doing that until we feel it's safe to bring employees back to the office. When we do come back, it will look different. Not every position will be required to work out of the office. We're trying to be mindful and thoughtful about which positions really are required to be in the office, and just want to be as safe as we can, with our employees. Some employees have children at school or doing, school from home. Some employees are high risk or have high risk family members. So taking all those things, and it's not a one size fits all. So really, being thoughtful for each employee and what it looks like for them when we do open our offices back up. I'm anticipating that that won't be until after the new year. So, these employee engagement surveys are very important just to keep a pulse on how employees are feeling, remotely. Are they still feeling supported? Are they still feeling, the culture and the atmosphere and things like that? And everyone's still reporting, the highest is that they feel that the culture is family oriented. And I think you feel that in your individual teams, and then it just goes up, up through ELT, executive leadership, and our CEO. You can reach out to her and talk to her anytime you want, and being able to do something like that is amazing. But I think that family-oriented culture has to do with, the care that we have for our employees. As soon as COVID hit, we went remote. We didn't have all the technology and things like that. We're still working through things, but just having that mindset and wanting what's best for the employees, and that spreads to our customers and really shows that we do want to inspire health. And then all the work that we do is rewarding. I think somebody else mentioned, I could be recruiting and, the positions I'm hiring for still help inspire health, even though I'm not a doctor or a pharmacist or a nurse practitioner. We all have a part in that. And I think a huge example would be the COVID vaccination site that we helped set up at State Farm. That was totally out of our wheelhouse. We don't typically provide direct patient care, but we figured it out and we made it work, and we helped stand up one of the largest vaccination sites within Arizona, and allowed our employees to volunteer, and gave extra volunteer hours for employees to go out there and support that effort if it was something they were interested in. It was pretty physical, so employees that couldn't do standing for 8, 10-hour shifts, we had administrative duties. We asked if they wanted to help with the email responses or phone calls or paperwork. So there was other things that we could really get everyone involved that wanted to be. And I think that just speaks a lot to our company culture and how we're all hands on deck. It is truly a family oriented atmosphere. When we are in the office, just before COVID hit, we were doing a lot of renovations, and you'll see, hopefully we get to experience those when we go back next year. But walking treadmills, we have an on-site gym with dietitians and fitness coaches, bevy machines to help give other healthy options other than soda, full cafeteria with healthy eating options, things like that. So a lot of great things that we're doing, just like other organizations that are present here today. And I think that really helps explain our culture for Blue.
Thank you so much. As you guys are speaking, I know Elizabeth mentioned hybrid schedules. Since the pandemic, there's been some changes as to how people work. So I want you guys as organizations to speak to that. I know for Final Mile, they're doing delivery, so that's not going to change. You can't do that virtually, so I know that's not going to change much. But I want to talk with CBI, Terros, Blue Cross Blue Shield, Peckham. What does it look like for employees now working for your organizations? Are there hybrid opportunities? I know a lot of it is member facing. So let's just talk about that, so the job seekers that are going to see these videos understand about what's available to them. And Mike, if you feel like you want to jump in, please feel free. But I figure for what you guys are doing, this might not apply to you. So I'm going to open it up with CBI first. Let's talk about, now that we're still dealing with a pandemic, what does that look like for your employees in terms of, are there hybrid possibilities based on different positions? What about the member facing positions? What does that look like?
Hi, so I can speak to that a little bit. I would say that many of our positions are still in person due to the nature of our programs. So we have residential treatment programs, inpatient psychiatric, 23-hour crisis, so on and so forth. So those programs are, of course, in person. Our outpatient programs, it would kind of run the gamut. For general mental health outpatient programs, there are definitely virtual opportunities. For the SMI programs, it is right now mainly in office and in community, and a big part of that is due to the current staffing shortages that we are experiencing and needing to have that workforce, as well as we oversee 6 forensic or 6 assertive or 3 assertive community treatment teams and 3 forensic assertive community treatment teams. And we are trying to leverage telehealth as much as possible within those programs. So the members do have the ability to receive services on a telehealth platform. So that is definitely there for our members. But as far as staff, I would say in definitely the SMI department, it is more in office with our general mental health outpatient being a bit more of a hybrid situation. And then our administrative programs have mainly gone to a virtual or hybrid platform. So within our human resources department, quality management department, finance, billing, so on and so forth, there would be opportunities within some of those programs to have a virtual position.
Thank you so much. Anyone else from CBI want to chime in before we move on? All right, so let's open it up to Terros. Same question.
Yeah, I can pretty much say ditto what Julie said. So we we have very similar operations right now. So for our patient facing, especially our field-based positions for our clinics that work with adults with SMI, we also have for sort of community treatment teams. Those are pretty much community-based, member-facing in the clinic type of things. And then our outpatient sites, as far as our federally qualified health centers, there is a bit of more opportunity for there to be like a hybrid schedule. So clinicians currently are doing 3 days in office, 2 days at home, so that there's some flexibility there. However, as we are seeing patient choice change and kind of they want to return back to in office, we are having to be flexible with how we're scheduling our staff to meet those demands. Because we want to be where the patients need us to be. And so we'll be flexible around that. For our medical staff, same kind of situation. So we have medical staff who are doing kind of a hybrid type of schedule, some days in office, some days at home. And again, we'll be flexible with that as our patient needs change. And again, ditto with Julie as far as our administrative roles. So we have some IT roles that are field-based. So those are coming in. So obviously the folks that need to come fix things physically, like they'll be out there. But we do have informatics, our medical records, our human resources, finance, revenue cycle, all of those sorts of positions are right now kind of on a hybrid basis based on need. So we do have opportunities for some 100% and then some hybrid in those more administrative types of roles. Heather, did I miss anything? Okay.
No, that's pretty spot on. The only thing I think too is what I think most companies are seeing now too is a lot of times candidates want to know if I'm going back in the office when, and unfortunately we're just rolling with it as well. We don't have any insight as to when things may change too. So yeah, we're kind of partially virtual, partial in person.
All right, well, thank you so much. Peckham, are there opportunities to work outside of the call center, or is everyone coming in?
Well, we're considered, because of the contract we have with the State Department, we're considered an essential employee. So
Okay.
we actually got a letter from our CEO in like March of last year that we had to carry around with us if we were ever stopped, which was kind of weird. Like, it was that eerie kind of feeling like if we were stopped when we're on the road, here's our letter that says this is why we're here. We attempted a work from home hybrid, but once our team member receives their security clearance, they have to be in person. So that kind of went by the wayside in the last 6 months. Some of our staff positions could work from home. Some of our human resources and human services, and myself, I can work wherever. I have a cell phone and I have Wi-Fi, I'm good. But as a recruiter, that's pretty typical.
Mm-hmm.
But yeah, some of our staff positions were able to work from home. We, as a company though, have decided to come back, and then of course mandating the mask still. But yeah, as a matter of fact, it's just the nature of the contract we have with the State Department.
Okay, well, a couple of other questions related to the pandemic that I want to ask all of you. With the recent FDA approval of the COVID vaccines, has your organization mandated staff be vaccinated? If so, please talk about that. And also talk about your office policy around COVID for any job seekers that are on the call that are interested in that information. I know we have some employers that are now mandating that their staff that are in the healthcare field be vaccinated. But I'm not sure if that's across the board, but I wanted to give you guys an opportunity to talk about that.
Is it okay if I start since I'm already?
Sure, yeah, go ahead.
Sorry. We're not mandating it right now. We haven't heard anything further, but we've held COVID clinic for shots. So we had a really great turnout for that. We are, of course, mandated for the mask. And during the whole first part of that pandemic, we had individuals that were coming in 12 hours a day, wiping down areas that were high touch points.
Mm-hmm.
We were doing the whole taking the temperatures and wearing a wristband that they were checked in. Trying to think of some other things. We did the whole social distancing. We had to move around our cafe area. Now we're back to where our team members can sit right next to each other, but we put up not plastic, but
plexiglass.
Thank you. See, Jose, you're hired. You're my second brain. You know what I meant, right? Plexiglass. So we're really, really mindful of what's going on. And our headquarters are in Lansing, Michigan. So they're kind of the ones that do the mandating of any protocol that needs to be done, but we're also mindful here in Phoenix of what needs to be done as well. So
awesome, thank you. CBI, any feedback around your organizational view around the pandemic and vaccinations and so forth?
So currently we are not mandating the vaccine. We are incentivizing our employees to get the vaccine, but we do have a robust mask policy. I like to say that I'm the senior director of masking, but we are required to wear masks at all times. So even if you're in your office by yourself, you're required to have a mask on at all times. We do have one point of entry at most of our locations where we're still doing temperature checks, so on and so forth. But yeah, we definitely are, continuing to push the PPE because we have seen it is hitting our workforce as well as our patients as well. So.
All right, Terros?
Sure. So we are also not currently mandating. However, we are very closely watching the new announcement that the Biden-Harris administration announced last week around potential mandates. And we are communicating with our staff around how those executive orders could potentially impact us because we meet potentially three of the four categories that they would be issuing these orders for. So we are very closely monitoring that and keeping our employees informed as much as we possibly can around how it could potentially roll out that we do end up having to mandate due to the federal requirements on that. We offer vaccines. So we are, like I said before, a federally qualified health center. So we can absolutely vaccinate all of our employees and we offer that. 4 of our locations, walk-in basis, an employee can just go anytime and get the vaccine. And then we also have had several clinics that we've stood up for both the community and for our employees and patients to be able to get vaccinated. So at this point, we are encouraging employees to get vaccinated as much as possible. We're tracking it. We are incentivizing as well for employees to get vaccinated. And then we also have a mobile health unit. So we have that operational. They do vaccines. And so for any employees who wish for us to come into their community and do that, we can do that as well. And let's see, I had one more thing. Oh, we are talking about, we have not implemented this yet, but we are talking about actually requiring new employees to come in with at least the first dose of the vaccine. So that is something for the folks that are watching this, that is a potential rolling out very soon, that if you would like to join us, we are asking that you are vaccinated. And really the reason is that if we do end up having to go with a mandate, we're trying to lessen the impact of how many employees could be then impacted by that, and then business impact that would have if we ended up losing folks. So we're trying to mitigate that on the front end a little bit.
All right, well, thank you for that. We'll go with Blue Cross Blue Shield. Any insight into this area from your organization?
I think we're right in the boat with everyone else. You know, what we start to roll out is going to depend on the executive orders that are finalized. Right now, we strongly encourage the vaccination. Part of working the vaccination site, you were considered an essential worker as a volunteer. So we were able to sponsor our employees as volunteers and their dependents. So our employees and dependents were eligible to get vaccinated after their shifts working the vaccination site. We did do a drive-through vaccination site at our campuses as well for those that were unable to volunteer and still interested to get vaccinated. And then we are looking at incentivizing them, those that are getting vaccinated as well, you know, to help with any out-of-pocket costs that they have for healthcare coverage with this too. So looking at similar things, I think we're all kind of trending in the right direction. The thing for us right now is that 97% of us are working from home. So not a huge concern in office, but our security guards that are still on campus protecting our assets are required to be vaccinated if they're going to be on site right now. And then we are masking, doing temperature checks. Anyone that has to go on site for any reason outside of security has to have executive leadership approval and then adhere to our campus rules to have that protective equipment on and temperature checks. Of course, not entering the office if you're feeling sick, you know, those types of steps.
Awesome. Thank you so much. The next couple of questions, it's a multi-layered question, and I'm looking at the time. So I definitely want to get this question answered for our job seekers that are going to see this video. Tell us about your interview process. What can one expect once they apply? What's the time frame? What does it look like? What's the best way to apply? And just give us a sense of that process for your organization. And we'll start with you, Mike.
All right. Well, I wanted to take a step back. We do have COVID protocols in place as well. Amazon has required that in the buildings, you are required to wear your mask. When the driver's in their van driving around, they're not required to have their mask on. Each morning they're provided with wipes to be able to wipe down all touch points on the van, as well as they're cleaned thoroughly. We provide the PPE for them as needed, and we stress the 6 feet rule. So obviously with us, we were essential to actually keep everything running. So our drivers, we've gone through a lot of attrition. So getting into the interview process, best way to find us is to go to Indeed. On Indeed, you'll look for a delivery associate for final mile delivery. Go ahead and fill that out. What I do is I typically, if you qualify, I will reach out to you and set up a phone call just as a preliminary, just to make sure that we have factors that we need to keep in mind, keep in consideration, such as how do you deal with the heat? Are you able to lift and carry 50 pounds upstairs, things like that. So that 10-minute call, we kind of filter through that. After that, I'll set up a face-to-face at the distribution center, where we'll go over pay, benefits, all that other fun stuff, and start the process of onboarding. So we have had a lot of attrition just because we because of the heat, now that things are starting to cool down a little bit, we're hoping, and we're pretty confident that we're going to see more activity on the job front.
All right.
Does that answer everything?
Yes. So Mike, just one last question regarding you. So from start to finish, from application to that face-to-face with you to go over, typically what's the time frame for that for an individual?
There is one variable in there. There's the background check. So there is a background check that Amazon has us perform. Sometimes that can take 24 hours. Sometimes that could take 2 weeks. The longest I've seen it take is about 8 weeks. But that's usually somebody who's lived in multiple counties, and the counties that they lived in at one point have shut down because of COVID, or there's nobody in the office that's actually providing that information. Amazon will not move forward until all that information is collected. So that takes time in order for that to happen. A normal interview to training is probably about 10 to 14 days. 10 to 14 days. So not next day, but because there are hoops that we need to jump through with drug tests and background checks and all that other fun stuff. And a lot of that actually has to do on the applicant as well, on whether they are finishing the tasks that Amazon is asking in a timely manner.
Okay, thank you so much.
Uh-huh.
All right, CBI, why don't you fill us in on your process?
Yeah, absolutely. Speed is kind of the name of the game. We are always trying to be eager, but especially in this climate right now. So we have a team of 6 HR assistants and 3 internal recruiters who are focused solely on reviewing our various channels of posting jobs, whether it's Indeed.com or elsewhere. And so we are scheduling, as soon as we receive an application, we're reaching out to you within the first 24 to 48 hours to not only say hello and thank you for your application, but to then schedule you immediately. We're not waiting for a prolonged screening process. Our managers are eager to speak with you. And so within the first 24 to 48 hours, trying to be on the site of 24 hours. We're having interviews throughout all the day with all of our managers across the entire agency throughout all of Arizona. So we're pretty quick on that. So we're kind of like when you send an email that you're just maybe interested in a car and 9 car dealers call you within 30 seconds and say hi. We're a little bit like that. We want you to know we're interested. We want you to know that we have positions really all throughout the agency. So you may apply for an RN and you don't have the exact education just yet. So we'll call you and tell you, hey, we appreciate that you applied for that. We have a great tuition reimbursement program. Having said that, we have about 6 other job titles that we know you'd qualify for, and they're located everywhere. So which one of these would be of interest to you? And we'll schedule for you an interview tomorrow or today. So it's a quick process. As far as now you've accepted the job, you're ready to start. We are doing new employee orientations on the weekly. That used to be twice a month. We now do it every Monday. And so we can start you as soon as you're ready. So I think that about covers it. But again, so I should add, once you've finished the interview, that same group of team plus an additional 6 HR generalists, make sure that you have an offer. We try to hit same day. So as soon as you've been interviewed, you should have an offer that day.
Oh, wow. All right. Well, thank you for that. Any additional input from CBI regarding that process? All right. Let's go to Terros. Provide us some insight into your process, please.
Sure. So we currently have a team of 4 recruiters within Terros, and because we have so many different departments and different positions, the process is that when a candidate submits both an application and a resume, it comes directly to the recruiters. The hiring managers may also see that information. So a candidate may be contacted either from a recruiter or from that hiring manager themselves. In most instances, the recruiter reaches out to them and they'll complete like a 15 to 20 minute phone screen with that individual. And then if it sounds like a good fit, we schedule them for a follow-up interview with the team on the clinical side directly. So the hiring managers or any other individuals within their team. We normally pre-pandemic would do in-person interviews, but we've been using WebEx to do virtual video interviews. If you're not familiar with WebEx, it's another free platform, just like Zoom. It's free and pretty user-friendly as well. Generally, there's only that one interview with the team. They usually make decisions pretty quickly from there. It's pretty common for the managers to reach out to us recruiters right after that if they want to move forward, and we call and make the offer as soon as possible, typically within the same day. We do require an application and a resume for every individual. We're currently having new employee orientation every 2 weeks. So every other Monday, we have the option for new hires to start. Our typical onboarding process is about 2 weeks for the background check. We require a drug screen, TB test results. So 2 weeks is usually a good amount of time for a person to get that completed. We have seen some delays. Somebody else mentioned with like background checks, with courts that may have been closed due to the pandemic, but they're starting to kind of pick up again. And so our typical 2 weeks is usually pretty on par. Yeah, I think that's pretty much it. It's usually about within 2 weeks.
Okay, thank you. Peckham, what's your process like?
Yes, well, again, it's a government contract. Need I say any more? So the quickest I've seen is 2 weeks to get someone into the class. We hold a class every 4 weeks. We're hiring over 300 people. We've had 2 successful classes so far. So bottom line, apply online. And please, 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 as a job seeker, clean out your mailbox, your voicemail box, because if I can't reach you, I don't know what else to do. If you don't have a clear, an email address that's working, please create an email address that's working. So they apply, we review within 24 hours. We make a phone call as a pre-screen. There's a few pre-screening questions as a recruiter that we have to ask. And then we get them scheduled for the interview as soon as possible. So they could be interviewed within 2 to 3 days of applying. After they interview, they have to do some computer assessments. There's only 2 of them, a keyboarding and a reading comprehension. Once they pass that, we send for their background check. They have to do it online. It's a link from an outside company. It's up to them at that point. So it could take up to 10 business days for that to clear. Depends on how quickly they get it done. Or it could only be a day or 2, depending on how much work they have not had or how many places they've lived, etc. And then once they pass the background check, we bring them on board for training. We initiate their security clearance just before they start new hire orientation. So the longest I've seen is 6 weeks. The shortest I've seen is 2 weeks.
Okay, thank you so much. Blue Cross Blue Shield of Arizona, can you provide a little insight into your hiring process?
Sure. So for all of our positions, of course, you'd have to apply directly for us to be able to consider you. I have it posted on our chat here, but it's jobs.azblue.com. Once you apply, typically you'd have a conversation with the recruiter. We call it a recruiter phone screen, but now a lot of those are moving virtual since we're using Teams now. So you'd be in contact with the recruiter, go over your skill set, the job that you've applied for. And like somebody else mentioned, our recruiter family is really tight knit. So we know all the positions that are open and actively recruiting. So if you're not a perfect fit for that specific position and we have another one in mind, we'll encourage you to take a look at that posting and apply and kind of give the recruiter a heads up and share resumes and things like that too. So having that recruiter conversation is really important. And that's why I encourage people to go to our website and, you know, connect with the chatbot and engage with the recruiter through there too. But after the recruiter phone screen, there's a little variances just depending on the hiring manager. They really own the interview process. Oftentimes it's one interview and then we're able to extend an offer. Our IT team is really good at doing panel interviews. So theirs is usually a two-part interview process, one with the hiring manager and then one with the panel, which is typically the team that the individual would be working on. Of course, for our executive hires, that might be a little different and be a little more interviews to go through as we include different leaders across the organization based on the visibility of that position. So it really depends, but I know the market right now, the candidate shelf life is really short and we're moving as quick as we can to fill those positions too. So would encourage you to apply. I would say our onboarding process is similar to others, 2 to 3 weeks. The typical from application to hire, I would say, is probably 6 weeks. And then just with those variances that I mentioned, depending on the number of interviews too.
Oh, thank you so much. Just a couple of things for folks who are attending this that are not on the panel. If you have any questions, feel free to put it in the chat at this time. I did see a question regarding your organizations. Do you have positions in Pinal County that you're looking to fill? Any of you have positions in Pinal County?
I can start since I'm already off mute.
Okay.
We hire for all positions within Arizona. So like I said, right now we're remotely, and when we open up the office, not every position will be required. So asking for flexibility there, but there may be a requirement that if there was a huge employee event or something that would require you to be on campus, which is off of I-17 in Northern, that you would be available to come in for something like that. Otherwise, we're able to support anyone throughout Arizona.
Awesome. Thank you so much.
Oh, go ahead, Heather.
I was going to say too, we also do have Families First positions all throughout Arizona as well. Somebody had asked about a Families First care coordinator position. I have to look at our website to be sure about exact locations, but I'm pretty confident that we do have that role in that area. If you want to email me your resume, I'd be happy to share that with the recruiter that oversees hiring for that location, and we can follow up with you yet today. I'll put my email in the chat again.
All right. Well, I'll just ask thank you to all the great organizations that were willing to share with us today. And if you haven't done so, please put your contact information in the chat for all the folks that are attending so that they can reach you. If you have a website specifically with your job listings, please put that in the chat. And then I'm going to share my screen one more time so Verily could take us home. All right, Verily. Should be coming up. There we go.
There we go.
All right.
There we go. Well, thank you again, our wonderful panelists. I so enjoyed hearing from you, your enthusiasm and your passion for what you do. Thank you so much for joining us today. So what I'm going to do now is
Verily, you're muted. You may want to unmute yourself.
I knew
there
that.
We go.
I apologize. So you didn't hear any of that then?
As soon as you got started, you muted yourself. So you may
Great.
want
to. Okay. Well, I'll backtrack. Apologies. I'd just like to say a big thank you again to all our panelists. I was amazed by your enthusiasm and your passion for what you do. And again, thank you so much for joining us today. We really appreciate it. So what I'm going to do now is talk a little bit about my day job, which is working for Arizona at Work, Maricopa County. And I'm going to go over some resources that we have for job seekers and employers. Next slide, please. So Arizona at Work is a statewide workforce development network. We help employers of all sizes and types recruit, develop, and retain the best employees for their needs. For job seekers throughout the state, we provide services, and resources, including access to apprenticeship opportunities, training grants, and employment opportunities. We do have 2 career centers, one in Gilbert and one in Glendale. They are open from Monday to Friday from 9 to 5. We have computers available for job seekers to look for jobs, work on their resumes, etc. We have many flyers there, job flyers there that they can pick up. And we are mandating everyone has to wear a mask, staff and visitors. And of course, we're observing social distancing, as everybody really is at the moment. And we're hoping that will end soon, but we don't know. So now I'm going to talk about Arizona Job Connection. Now, if you think of Indeed, which is fantastic, well, Arizona Job Connection is an alternative to Indeed, and it's free. It's absolutely free. It's a statewide database of employment opportunities where job seekers can search and apply for jobs and post their resumes, and employers can post their jobs. So what we're hearing from many employers across all sectors is that they're finding it very challenging to get employees. So if you want, I've put my contact details in the chat. And if you want, I can help you, employers, post your jobs, or I'm sure some of you, of course, have your own career sites. Having said that, if you have any flyers that you'd like me to distribute to our networks and place in our centers, I'll be very happy to do that. So it's a great time to apply for a job. And here is the website. And again, please ask if you have any questions. So next slide, please.
Verily, I'm going to interrupt you just for 1 second. I want to apologize because I believe I made a horrible mistake for this meeting. I believe we have someone who's an attendee from Copa Health that was supposed to be on the panel, and we kept them as an attendee. So I want to take the opportunity to move him to the panel really quick, and it's Steve Hilger. And I'm attempting to move him to the panel just to give him an opportunity to introduce himself, give him the last few minutes to talk about Copa Health, if that's okay with everyone. And Steve, my sincere apologies for that. I just saw you put that information in the chat and I was like, oh my goodness, he should be on the panel. So please go ahead and unmute yourself and the floor is all yours.
Oh, no problem, Jose. Thank you very much. I kind of joined last minute when I got the invitation. So I'm sorry, I didn't know I was supposed to be a panelist because I could probably sit here for the next 2 hours and talk to you about Copa Health. But I definitely want to say hi to our community partners like Terros and CBI. Very familiar with you guys and what you do. So I'm glad to be here. Well, hi, my name is Steve Hilger, and I am the Director for Behavioral Health Housing Services for Copa Health. I've been with the organization for a little over 18 years. I started with them as kind of a full-time behavioral health tech and kind of moved up into my current position. Copa Health has been around since 1957. We actually started out as Mark Center of Mesa, and then we changed our name to Mark Community Resources. And then we merged with our sister company, Partners in Recovery, to become Copa Health. So now we're one big organization. We provide, oh my gosh, so many services. We have behavioral health housing, we have DDD housing, we have 7 integrated health clinics in the East Valley, the West Valley, and as far as Wickenburg. Our population is mainly adults. We just started a children's home that's kind of a pilot program for us, so we're still working with that one home. But we have programs for IDD adults. We have day programs and homes, employment-related services. We also have that for our SMI adults also. So we have a whole lot of things, and some of those members on our SMI housing side probably go to some of the programs that you guys have. I know we've had them at CBI and Terros. We've had case managers from CBI and Terros. So we love all you guys because we all work together and kind of in harmony, and that's pretty cool. And I heard a lot about self-care and wellness. That is big with us right now because, as we know, the pandemic is really kind of taking its toll on us. So we do have a person that just kind of oversees wellness for all of our employees. We do have 2 gyms one on the east side and one on the west side for both members and for our staff. We too, again, are kind of all over the place. We're in the office, out of the office. Again, we also follow all CDC guidelines. We are not currently mandated at this time either to be vaccinated, but our CEO really is making sure that she promotes that as much as possible to try to avoid that, to get everybody vaccinated. We do follow guidelines. So anytime you go onto one of our properties, we do have to take your temperature. You do have to wear masks, the social distancing, the washing hands. In all of our homes, we make sure they're sanitized, throughout the day. Our members, we kind of really take care of them also to work with them on CDC guidelines when they're out in the community. In a nutshell, trying to wrap it all up here for you. So I don't know if you have any more questions about what we do. One thing we also do for our staff is we just started like a leadership academy. So all of our leadership goes through like a boot camp type academy. We promote from within. A culture, a wonderful culture. That's why I've been there for over 18 years. It's a great culture where they really care about the staff. They really kind of care about having an environment that you want to come to work in every day. And again, it's all about the members we serve. I've heard people talk about members, and if you can't take care of yourself, it's going to be a little hard to take care of your members. So we definitely want to make sure that we talk on a regular basis with staff about self-care. So we do have clinics that have pharmacies in them. So our pharmacies kind of jumped in. We were able to go get vaccinated at our clinics that had pharmacies. So I was able to go to one of those clinics and get my first and second vaccination. So that was really helpful. So just a really wide array of programs that we do have to offer, and like mainly adults right now. We're kind of just starting up on kids programs on the BHS and DDE side. So
all right.
Questions? I know I threw everything a lot at you one time, but
all right. Well, thank you so much, Steve. And again, my
Yes.
apologies. And
Oh,
I
no
see
problem.
that your information's in the chat. So if
Yes.
folks have additional questions, please reach out to Steve. And then Beryl, I'm going to put some pressure on you to wrap us up. All right.
Oh, my goodness. All right. Thanks so much, Steve. Appreciate it
welcome.
very much. Thank you. So next slide, please, Jose.
All right.
Talked about Arizona at Work, Arizona Job Connection. Just a couple of the things that Arizona at Work, Maricopa County offer job seekers, as you can see, an employment academy. This is how job seekers sign up for it. Next slide, please. We also send out an incredible job blast newsletter to job seekers twice a week with containing lots of different jobs and opportunities, etc. So any job seekers that want to sign up, it's AZATWORK to 22828 to get started. Next slide, please. Just some of our community partners. I'm sure you're familiar with a lot of them, but we rely very heavily on our community partners, and we work very closely with them. So next slide, please. A couple of upcoming events just to talk about. We're having our East Valley Jobapalooza next Thursday, September the 23rd. There's various companies. They're not just hiring in the East Valley. It's pretty much valley-wide. As you can see, there's Banner Health, Honor Health, etc. So lots of great companies. It's a virtual event. Then a national job fair, September the 29th, as you can see. Lots of companies there. And next slide, please. Maximus have an online job club every Friday. Some employers are on the call, and they talk about, a bit similar to today, they talk about the jobs and what they can offer, etc. And attendees can interact with recruiters. Next slide, please. Save the date. Our next virtual event will be on Friday, October the 15th at 10 in the morning. Our guest speaker, we're delighted to announce, will be Sheila Coulomb, who's Director of Operations with Career Connectors. So I'll be sending out a bit more information about that shortly, but please do mark your diaries and have a great weekend. And thank you everybody for attending. We really appreciate it. Thank you so much.
Thank you all. Have a great weekend, and thank you so much. Bye-bye, everyone.
Bye-bye. Thank you.
Thank
Bye-bye.
you.
Bye-bye. Thank you.
Bye.
Bye.